Good morning, Chairman Rowe, Dr. Prasad. Congratulations, Director Armstrong. Krish Gundu, co-founder and director of TCJS project. There are two items on today's agenda that I want to address. First is women's sanitation and health. We've been advocating since 2008 for better county jail conditions, robust policies, and stronger oversight. As some of you know, every single law and minimum jail standard related to pregnant people, starting with counting them, mandating prenatal care, transport to hospital, and onset of labor, limits on shackling during labor and postpartum, and data collection on pregnancy outcome. All of these rules came out of our work. We made a lot of progress, but one conversation we have barely made any headway on these past 20 years, and I'm deeply embarrassed and frustrated that we have to keep bringing it up, is the issue of women's hygiene and adequate access to underwear and sanitary products. We recently heard from Ritu Sambige, a third-year medical student from Baylor College who has been teaching health education classes for the past 3 years at the Harris County Women's Empowerment Center. That's just a fancy name for a women's jail. You have a written comment with her recommendations, but I wanted to read a few sentences from the email she sent me. Maybe her comments as a medical professional will make a difference. She says, through this work, I have witnessed both the resilience of people in custody and critical gaps in access to basic health needs, particularly for women in custody. In our women's health sessions, we teach simple evidence-based practices such as wearing clean underwear daily and changing menstrual products every 4 hours to prevent infection. However, women in custody consistently tell us these recommendations are not feasible in their current conditions. We have heard repeatedly, and she quotes some of the women, we only get 2 clean pairs of underwear a week. We don't have adequate access to laundry. We know the recommendations are important, but they're just not possible here. And we don't have enough pads to keep changing them every 3 to 4 hours. These are not isolated concerns, she says. They reflect a systemic gap in access to basic hygiene. From a medical perspective, this has clear consequences because prolonged use of unclean underwear and inadequate menstrual hygiene increase the risk of infections such as bacterial vaginosis, vaginitis, and yeast infections. In fact, in the last 20 years of doing this work, I have never spoken to a woman who came out of a jail who did not have a UTI, and in fact, antibiotic-resistant UTI. So these conditions are not only painful and distressing, but if left untreated, they can lead to more serious complications, including pelvic infections and adverse reproductive health outcomes. This is a controlled environment where individuals cannot mitigate these risks on their own. This is not just a matter of dignity, it's a preventable public health issue. And as you can see in your handout, she urged the Commission to take action to ensure access to at least 1 clean pair of underwear per day and sufficient menstrual products, approximately 5 pads per day during menstruation. This is a low-cost, evidence-based intervention that can prevent avoidable illness and improve health outcomes for a vulnerable population. I also wanted to give you a quick report on custody deaths this year because I know you don't have that in your books. As of last night, there were 49 reported custody deaths, but the data breakdown I have for the details is for 30 recorded until April 1st. Of the 30 reported deaths, 3 people died the same day they were booked into jail, which probably meant that they were unfit for confinement. 5 people died within the first week, 12 died within the first month. Of those 30 deaths, 1 person was convicted of charges, 23 people had charges filed, 2 people had not had charges filed at the time of death, 3 people were incarcerated for a probation violation. Of the 30, 24 died in a hospital, 6 in a jail. These numbers do not include people like Ms. Reba Bailey's elderly mom, whose death has yet to be reported. The last thing I want to address, if you'll give me a little grace, is the guardianship rules on the agenda. We are very grateful to the Commission staff, Director Armstrong and Ms. Johnson, for their thoughtful work on crafting the rules. County jails are the only institutions in Texas where no guidelines or rules exist to care for wards with court-appointed guardians, people whom the courts have deemed to have limited or no capacity to care for themselves. People who are very, very vulnerable in a jail setting. It took us over a year to get these rules to you all, and I really hope you will vote unanimously and pass them. Thank you.
Thank you.